So now I'm kind of let him loose, and I'm kind of doing these oscillations again. I think Eric, you did videotape a little bit about the principles of Codman's and pendulum exercises and things. So kind of stimulating some of the mechanoreceptors in his shoulder, trying to give him a little pain relief. He was doing great, but then he started guarding on me a little bit, and I'm just giving him a little bit of a break with regards to that. We're going to try to work on some flexion now. So he's doing really good. Again, if you can see on the camera, I've got him kind of pinned against my body, and I'm going up on my tippy toes. I want him to feel really comfortable that, you know, I'm not going to let go of his arm. You know, sometimes I'll put the pillow back underneath here again. Something like that. And I'll use the high-low table. Okay, I've reached the kind of little level of guarding again here. So I'm just going to do a really gentle distraction. He's wanting to hold on. So take a big breath in for me there, Eric. And then give me a good exhale. Let's do another one of those. There's a bit of a negative pressure inside the shoulder joint there. It causes a bit of a suction to occur. And so I'm just trying to get a little distraction to kind of free that up. And now his flexion has kind of been released. So now I can move him into flexion, which I couldn't do a minute ago. So, you know, this takes two to tango. I gotta have a patient that has a lot of confidence and trust in me. You know, Eric's a therapist, but having a lot of pain. And as good as he is, he's being a typical patient for me, which is someone who doesn't want me to move his arm too much. I mean, he wants me to move his arm, but he's having a hard time letting me do it. So I'm really having to kind of go through all my little tool belt. And now he can get his hand to his mouth, which is kind of nice. So we're going to do a little functional activities here. So you're just going to kind of, again, straighten your elbow. So the bicep is now a gravity-assisted type action. So the tricep is working almost the whole way here, eccentrically lowering his hand to his mouth, concentrically bringing his hand away. So we are in Florida. We have a lot of college football fans here. Some of us are Gators, some of us are Seminoles. This happens to be a Seminole chop, but that's not something we prefer to be doing if we had our choice. We'll have to do the Gator chop when he gets a little stronger. But basically, this is kind of nice for him just to be able to feel like he can do some things. And now I'm going to actually stretching this bicep again. Now you can turn palm up there for me, Eric. Open your hand up. Now we're just going to really stretch out this whole system here a little bit. So now I'm working on some of his forearm, his distal bicep. But I've got his shoulder really protected. On this angle here, there's a reason why I have him where he is. This is called an escaption plane, which is about 30 degrees from the front, about 30 degrees forward. It's basically where the humeral head is in the most congruence with the glenoid, which is the socket of the shoulder. So I feel really good about the load and the tensions that I'm putting onto his repair sites, and allows me to work. You know, I can do a lot of myofascial work in here if I wanted to. Really just freeing this up. You can do some hand squeezing. Go ahead and squeeze hard as you can. Pretty weak. Open up. Squeeze again. Eric's actually a very good therapist with regards to lymphedema. And the lymphatic system helps move waste products around our bodies when we have trauma or infections or reactions to different things. The lymphatic system can get kind of overloaded and clogged, and they get stimulated or moved by muscle action. So it's really important for our patients to be doing the ball squeezing, but doing the hand and wrist exercises. Eric mentioned to me this morning when he came in that he was really having a lot of hand swelling after surgery, and he was doing some of his self-lymphatic massage that he teaches his patients, and to help really get that swelling out of there and to stimulate that out. So Eric teaches his patients kind of a self-massage protocol. He's probably doing that a little bit on himself. He might be able to explain that in another video about how you would do that. All right. So I'm back to some oscillations again because I just kind of changed positions. And he started guarding on me. So I'm going to go back and work in the abduction again. Really getting some good range here now. Paying attention to that pain resistance scale. And another thing we talk about in physical therapy is endpoints. What's the endpoint like? We had a good friend of ours come in yesterday for after surgery, 2 weeks out. He did not have a rotator cuff repair, but he had a different kind of labrum injury and repair on a different part of the socket. And so he has some different precautions and protocols than Eric does. And one of his bigger precautions is how much internal rotation we're allowed to do. That would be loading the part of the repair site that he had done. And he's actually pretty limited in that direction, and so much so that the end point is very hard and firm. And I told the gentleman yesterday, a friend of ours, that we're going to have to work on that a little bit within the guidelines of the surgery. But I didn't really like that end point. I thought that was a little too hard of an end point at that stage of his recovery. How we doing, Eric? Good. Now we're going to work on a little bit of rotation, which he doesn't like. So I'm going to have to kind of trick him. External starting to feel a little better. Where do you feel a catch? Right in there somewhere. So he's got kind of pain before resistance for a lot of these two motions here, internal and external rotation. Not really worried about that at the moment. We can kind of accomplish that at another point in time. The big goal for him is to try to get him some good flexion. He will not be allowed to do active flexion for a while or load that bicep for a while because of the extension of the repair that he had done. And he won't really be allowed to load the rotator cuff muscles for a while either. So his strengthening phase is going to be delayed based on the operation notes that were received and the communication we had with Dr. Deschma. So getting a little bit more aggressive with him. In some of our later sessions, I'll show you some techniques that I'll be doing there. I got it. So he's feeling like a little bit of a catch. He's got some guarding. I'm going to go ahead and do some distractions again. Breathe in and out. All right, one more time. That. Some of our next sessions, we're going to show you some things that he can do with total body exercises. You can leave it running, it's fine. It's good to have you sit up. Ready, 1, 2, 3. Let's go. Legs off and sit up. All right. That's kind of a long time to be laying on his back for the first time in a while, so. All right. Eric's doing good. You know, again, just trying to work on some relaxation. How you doing there, Eric?
Good.